So hi there. I'm joined this morning by Dr. Eoin from the Student Health Unit, and we're very grateful you could make it here this morning. So what I might do is let you introduce yourself and kind of what your role in the unit is at the moment.
No problem at all. Thank you for having me. So my name is Eoin McDonagh. I'm one of the doctors and the medical director here in the Student Health Unit in NUI Galway. I've been working here in the Student Health Unit service as part of the team since January of 2012 and just took over as the medical director in the facility since September of 2019. At the moment, the Student Health Unit, I might just mention, is we're temporarily relocated due to the HSV requiring use of the Orson-Maclean and adjoining facilities. So the Student Health Unit and the team have been temporarily relocated to a separate facility up in Mayola, in the Speech and Language Therapy Clinic there on Upper Newcastle Road inside the gates. But we'd be hopeful that down the line we'll be moving back to our previous Student Health Unit practice in the Orson-Maclean building upstairs there beside the Students' Union for the next academic term with that.
Okay, great. And what's going on kind of currently in the environment and the way we live, are the doors open? Can people just walk in, or would that be the usual situation? Or
yeah, so again, we're operating in changed circumstances temporarily anyway, for the duration of this COVID-19 outbreak. Previously, the standard type of service we would have run routinely would have been a walk-in service, kind of first come first serve for appointments being issued for acute illnesses and stuff like that. There would be certain things that there would be pre-booked appointments for, such as like travel vaccines or implant contraception or war treatments and stuff like this, or physiotherapy. But for the vast majority of acute illnesses that we would have been seeing, it would have been a kind of a first come first served, with people queuing up outside in the morning or in the at lunchtime prior to the morning and afternoon clinics. With the outbreak of COVID-19, obviously things have changed greatly for ourselves, as they have for GP practices all across the country. And in the interests of public safety and for infection prevention and control reasons, like all kind of GP practices, we have moved away from patients just arriving at the practice without first making contact with the team or without having an appointment. Most consultations now are moved to telephone-based kind of triage and consultations. A limited number of maybe video consultations where necessary to view rashes, etc. And there are still a limited number of consultations that are undertaken face-to-face, but these are restricted in the interests of, in particular, the students, we'll say, or the patient and the staff. From an infection control perspective, these are limited to a small number of clinical complaints and conditions whereby maybe a blood test is absolutely necessary. There's no way of proceeding without a blood test, or perhaps a swab test or that. So the likes of an STI screen we can't undertake remotely, obviously. So those kind of things, obviously, you do have to bring the person in. But even the people we bring in, we follow the guidance from the Irish College of General Practitioners and the Health Protection Surveillance Centre in the HSE, the Public Health Department, on using kind of the type of PPE that would be required for those types of consultations.
Yeah. On that, I know you mentioned STIs there. What kind of services does the Student Health Unit provide for students?
Yeah, so normally, I guess we're here, the Student Health Unit team is here to kind of support students in terms of their mental or physical health during their time in college. I guess it's important to stress that we're not a replacement for a student's GP, and they should always at all times remain kind of registered with their own home or local GP practice. We try to focus on supporting students. The vast majority of issues they may present with might be acute, and by that I mean illnesses that just come on, short-term illnesses such as like a urinary tract infection or a sore throat or a cough or a flu, skin infections, rashes that may arise, acute mental health issues, these kind of things. For people who have like ongoing or preceding medical conditions, like long-term medical illnesses, again, it's really important to stay linked in with their home GP in general. for the purposes of continuity care and for safety in terms of kind of their medical records, etc. But we would still, those kind of people could be like asthma, you could get an acute exacerbation of your asthma flaring up, or someone who has an inflammatory bowel disease, that they could get a flare up of their symptoms, or rheumatoid arthritis, these things. So while it's still important that you remain linked in with your GP in the main, we are able to see those people if they get flare-ups, or people who have chronic conditions. We can still see them if they need, we can be there to kind of provide a prescription if they're not able to make it home to their own GP, or if they need a blood test during term and they can't, and as a part related to their condition and they're not able to make it home to their GP, we're able to kind of assist and facilitate and support the students in that way. There will be other kind of consultations or issues, we'll say, that would be more predominant than amongst a third level student health cohort or population. So, stuff like contraception, sexual health services, travel vaccines, and then through maybe sports and stuff like that, physiotherapy, and that. So we would see people, if people have acute illnesses that can't be managed, like a UTI, let's say if something comes in, someone could come in with a sore abdomen, like a sore stomach, a pain in their tummy, and it could be an appendix. So we would refer them. We're very fortunate in NUI Galway that the local tertiary care specialised hospital is only across the road. So we're able to refer people to the A&E there, or if there's something that needs further hospital investigations, we're able to refer them on to like medical assessment units or surgical teams. So we are able to refer people on where necessary as well in relation to issues that may arise. That'll be a kind of a broad picture of
and if like with an international student, I presume the same will apply. You could rock up and be seen by you guys, even if I don't have a family doctor, I'm not able to get to a family doctor.
Yes, I guess even we would see some students as well who it may be difficult to get access, because obviously there's a huge pressure on GP practices in general. Now again, we're in these an unusual circumstance with the COVID, but sometimes students can't get in to see their own GP, and may need to use us, and that's absolutely fine. Students are able to come and see us. All students are able to come and see us. And then in particular, as you mentioned, for the international students, while they're here, they obviously don't have a GP. So we would kind of fill a gap as nearly being their GP while they're here residing in Ireland and a student of the university. I guess the key thing always, like I said, and the key point to probably re-emphasize as well, is at the moment we're in this COVID outbreak nationally and internationally, and during this period, the ways if students need to engage with us or engage with our services or get advice. So a lot of stuff we are able to do remotely anyway. As I say, in terms of advice, support, sometimes referral, prescriptions. The government have enacted legislation whereby prescriptions can be sent from a GP practice to a nominated pharmacy via secure health services email. So we're able to facilitate and assist students in that way. But the key thing always is the point of contact now for the student health unit for the foreseeable future until we get out the other side of the COVID-19 outbreak is phone call. And so they ring us, like our number here at the moment is 091 494 337. Or if they go on the I guess a great source of information at the moment in this period is the alert page that the university have. And if they go into the student frequently asked questions FAQ section there, and the health and well-being, and there are all the details, our contact details are there, including details of kind of weekend out of hours cover and that. So as I say, for the moment, for the period of COVID-19 outbreak, a really great place to go. They can go to we have a section in the college website for the student health unit, and that has actually a link then to this COVID-19 alert page that the college have. But the student FAQ section, and go for the health and well-being, and once you're in there, at the top of that health and well-being section is the student health unit with most of the kind of common questions that students might have, but in particular the contact details for us. But for the moment, the key number is 091 494 337.
Okay, that's excellent. All right, thanks for all that, Doctor, and we'll talk to you again soon, I'm sure. Good to know you're still there. All right.
I'm still here, haven't gone away. You're very welcome. Bye.
Thanks a million. Bye-bye.